Have you ever had a heart attack and not been aware? I want to demonstrate how to run a 12-lead EKG. An EKG is a painless test that records the heart's electrical activity. We use the EKG to determine a heart attack or any arrhythmias, some of which may be lethal. First of all, we're going to position the patient. The patient should be very still and not moving. There are 10 leads to attach in the 12-lead EKG. First we have V1, V2, V3, V4, V5, and V6. Then we have one for the right arm, the right leg, the left arm, and the left leg. And then we place our leads that go in these positions, which the EKG machine is color coded and labeled, which makes it easier. So we'll attach these to the right leads. V2, V3, V4, V5, and V6. Left arm, right arm, right leg, and then our left leg. Then I'm going to ask my patient to lay still. Now that we have all our electrodes applied correctly, incorrect placement of the electrodes will prevent the EKG from reading correctly. So we perform an EKG because with each heartbeat, an electrical signal spreads from the top of the heart to the bottom. As it travels from the top, the heart signals causes the heart to contract and then pump blood. Alright, so we get our EKG rhythm out, and as it prints out, I would talk to my patient about what the EKG shows as far as if it's too fast or too slow, if it shows a cardiac arrhythmia. And at this time, if it does show a cardiac arrhythmia, then we need to go over with the patient, following up with a cardiologist and seeing if there's anything else that they need to do. If you have had a heart attack in the past, it is recommended that you have an EKG done on a yearly basis. To sum it all up, an EKG shows how fast your heart is beating, whether the beat is steady or irregular, the strength and the timing of electrical signals as they pass through each part of the heart. All right, and that's the end of the demonstration.